Hi, I'm Sean Welby. Welcome to the FamilyGP.com TV with me and Dr Chris Steele. Now, if you're a parent of school-aged children, then you've probably had to deal with head lice at one time or another. Apparently, nearly 1 in 10 children are affected at any one time. More worryingly, it seems that 80% of the crafty head lice are now resistant to the most commonly used insecticide treatment. So in this video, we'll talk about head lice, what they are and how to treat them, and look at the new form of treatment that's more effective and that doesn't rely on poisons or insecticides. And we'll also expose some of the myths about head lice. So Chris, what are head lice?
Well, head lice are insects that live on your head. They cling to the hair with their powerful claws, and they feed on blood from your scalp.
Oh, nice.
Yeah, and it's the actual feeding through the scalp that causes the itchy symptoms. And then, on the scalp, you've got a lot more female head lice than males. And these female head lice are getting pregnant again and again and laying their eggs, which stick to the hair shaft. And those eggs will hatch a new head louse, leaving behind the egg shell. And that's what nits are. Nits are not the lice. Nits are the actual egg shells that the baby head louse has hatched out of.
Oh, lovely. So how would you know for certain that you had head lice?
Well, you may not know for the first couple of months.
Oh.
And, but usually the commonest symptom is itching. And of course, head lice are far more common in children. So, your child might be itching behind the ears, itching at the back of the neck, itching anywhere on the scalp. And often it's worse at night, when these head lice are sort of pretty active, feeding on your blood. I mean, they're basically parasites.
Now, there can be a lot of stigma attached to having head lice, as people think it means that the infected person is dirty. Is this right?
No, not at all. There's no connection with that whatsoever. In fact, there is a feeling that actually head lice might prefer cleaner hair than dirty hair. But of course it's a terrible stigma when a mother hears that her little child has got head lice, and of course that child won't be the only one, because that child has caught the head lice from somebody else. And of course, head lice can spread, very quickly through a classroom, through a school, through a family.
Okay, so what can you do if your child does have head lice?
Well, first of all, have a look at the hair and see where the nits are. This is going to give you an idea as to how long your child has been infested. Hair grows about ½ an inch a month. So if the nits are, say, 2 inches from the scalp, that means your child has been infested for 4 months.
Okay.
Right? Yeah. So that gives you an idea, right, where that nit is. Now, there are various ways of treating head lice. For many, many years, we've been using insecticides. These are powerful chemicals that actually kill the head lice, but they don't kill the eggs, the nits. Right. So you have to apply these lotions, gel, shampoos, and then repeat the dose about 7 days later, because if the nits are hatching, you've got to kill off those baby head lice. So it's a treatment now and a treatment again in 7 days' time. Now, the problem with these powerful chemicals, they can be very irritant, they can irritate the skin, they can make people with asthma have a flare-up of their asthma. If your child's got eczema, some of them are alcohol-based and they can irritate the skin as well.
Oh, so is there any newer products on the market?
Yes, there are silicone-based lotions on the market now. Now, these are very interesting because the way they work is they coat the head lice in silicone and basically smother it. Right? Now, basically what you're doing here, this is a physical treatment rather than a chemical treatment. So the head lice are being smothered and they die. And then, the eggs will hatch and they'll be treated as well. But it's this type of approach now overcomes a big problem, that is resistance. We've heard about bugs being resistant to antibiotics. These head lice, very clever little creatures, are developing resistance to these chemical treatments. 80%. of head lice are resistant to these chemicals. So, you know, we need to get away from these chemicals and get towards more sort of natural physical treatments that actually kill off the head lice in the way that these silicone products do.
So once you've treated the infestation, what next?
Well, you need to make sure, you know, you have cleared the infestation.
Yes.
And the thing to do is to check, you know, the child's head. And do this with a knit comb. This is a very fine tooth comb you can buy from any pharmacy in the supermarket. And what you do is actually you scrape this very fine tooth comb from the root of the hair all the way along the whole length right to the end. The hair should be wet, and conditioner should be applied as well. This might take you about 10 minutes every night, going from the root all the way to the tip of the hair. And try and do this over, say, a white towel or a white tissue, because if you're getting the nits and the head lice off the hair, you can see them on the white paper. Head lice are very small. Sometimes you can find that your child has got head lice by looking at the pillow, and you might find the pillow looks a bit dirty, and what's causing that dirty appearance are droppings from the head lice collecting on the pillow.
Oh, it just gets worse and worse. Now, we've actually had some questions from viewers about head lice, and here are some of the most commonly asked. First of all, can head lice jump from person to person?
Head lice can't jump and don't fly. Right? The way head lice are transmitted is from head to head. They hike from head to head. They walk. They've got no wings. So this is why children get head lice, because look at children in the classroom. They've got their heads very close to each other, and those head lice are just walking across to the next head, a whole new fresh area to feed from. And actually, I'll tell you a very interesting story. This is a story of an old lady who had a corner shop in Cambridgeshire, and she used to get the children when they come out of school, they come in to see her, and she would lift the children onto the counter, give them a cuddle, and give them a chocolate biscuit. And they couldn't get these children cleared of head lice. They were just infested again and again and again. And eventually, by doing detective work, they found the old lady was heavily infested with head lice. She was crawling with them, and when she gave the child a hug, the head lice were transferred across. So keep that in mind, because head lice can affect elderly people, and they don't get itching, they don't have any symptoms.
Oh, so obviously adults can get head lice as well then?
Sure, of course we can, yeah.
And can head lice be caught from, say, sharing pillows and hairbrushes?
It's possible, but very, very unlikely. Head lice, you know, don't like being off your head, the warmth of the head, the nice fresh blood, so they don't survive, you know, long off the head. But if you want to be ultra cautious, then if you're treating your child or children, you know, separate hairbrushes, you know, separate pillowcases.
Okay, Chris, thanks for the advice, and you really should stop hugging those old women. Okay, if you need any more information, you can visit the website onceaweektakeapeek.com. Head lice treatments are available from all leading chemists. Ask your pharmacist for advice. You've been watching the Family GP TV with me, Sian Welby, and Dr Chris Steele.